Yeah, I'm Bill Atkinson. I'm President and Chief Executive Officer of the Wake Med system in Raleigh, North Carolina. And Wake Med is one of North Carolina's largest hospital systems. We are a private, not-for-profit organization. We began years ago as a county hospital operation, but about 5 years ago converted to become a private, not-for-profit. We are the sole trauma center in Raleigh, the capital city of North Carolina, and in Wake County. And we are the largest provider of health care in this community. We have about 6,000 employees in the organization, about 1,000 volunteers, perhaps as many as 600 physicians associated with the organization. We're a major teaching site. About 1/4 of the entire University of North Carolina School of Medicine residency program rotates through our institution. And so we have a significant number of residencies here in every specialty, from intensive care medicine to emergency medicine, psychiatry, and all things in between. We are with the state's first pediatric-only emergency department, which is a separate emergency department here. And then, as mentioned, we have a very large emergency presence on this campus where we're filming today, which is the New Bern Avenue campus. This is the largest, busiest emergency department in the state of North Carolina. Well, I thought I was going to be at Rockingham County for just the summer, but I ended up staying a little over a year, and I became the training officer for that agency after I'd gotten EMT and started helping move people through the initial course, the pre-EMT course, to when North Carolina put in EMT, although they did allow our folks to go back and certify as EMTs off the training we had developed at home. And when it was time, I just sort of knew it was probably the next level for me to go on. And so I was over in Greensboro, which was in the city, in a county next door, and was over at the University of North Carolina at Greensboro one day with a friend. And I'd not been on that campus before, but just decided this would be a good place for me to go. And so I became a student, came in the mid-year, came in the January start of that year. And a fellow named Jim Fennison, who was, I think, a very early leader in emergency medicine in our state, and invited me at that time to become part of the Guilford County Emergency Medical Service. And Guilford County, I think, was very advanced for its time, and probably one of the first agencies in North Carolina to do many, many things, including EMT and paramedic, and then called mobile intensive care technician. And so very early on, I was able to come straight from Rockingham County to plug in on a part-time basis for the county agency, which was Guilford County. And at the same time, it was clear that we had all these, we had several thousand students on this campus, and they were involved in a lot of activities, and I guess it was part of being young, but it seemed to me at the time that perhaps we could be involved in something that also contributed back to society. And so we formed a group called the Emergency Medical Services Association, or EMS, or EMA. It actually was Emergency Medical Association that later became EMSA. And that group became, in a fairly short period of time, the second largest organization on the university campus, with young people who wanted to be involved in all aspects of emergency medicine, this emerging thing, from people who went on later to become actively involved and are still actively involved in EMS today in many states, but people who were going to nursing school, and people who were going to become physician's assistants, and people who became paramedics. And we reached out and found advisors from a number of areas who were willing to come give time. There was a physician there named Bill McRae, who's now passed away. But Bill McRae was very interested in young people, and while he didn't claim to know a lot about emergency medicine, he knew a lot about young people, and he helped us get in touch with people who could help us learn more about EMS. And that group was involved in bringing guest speakers from around the country and training, and we began the first campus-wide CPR effort. And through a couple of foundations, the ACT Foundation, we were able to get monies for resuscitandols and a number of other things over time to begin a campus-wide effort to train people in CPR. And at the time, I think we trained, probably 1/10 of the campus was trained in a very early basis. And then we began to cover university concerts with EMTs, and it was something to behold, to watch. And It was a great learning opportunity, and many young leaders were trained in that operation. Well, you know, I think there are several things I would share with anybody that's at the front end of their career, regardless of where that career would be. One would be, regardless of the area you pick, there's no reason you shouldn't be the best on the face of the earth at the things you do. And even if you're unable to obtain that goal of being the very best, you ought to be working on trying to be the very best every moment of your waking day, and hopefully in your sleep too, thinking about it. I think you owe it to the people you serve to get out there and make it happen, and to make it happen in a correct way. You have to stay connected to people outside your own system, because there's just a lot happening in the world and a lot of advances, and you need to pay attention to those things. The best ideas don't always come from home, and naysayers will always tell you the only ideas come from home, and it's my opinion they're just wrong. There are some fine ideas that come from home, but that changes. I think education, no matter where you go in life, if you can maximize your education, don't always ask why, just do it. If you're in healthcare, you're going to deal with the folks in healthcare, for the most part, are some of the highest trained and some of the highest educated folks on the face of the earth. If you're going to have the respect and you're going to have the attention, as a whole, you have to work on the academics. It's not an option, and you may have influence in some small circles because you're good at what you do, but when you come to the table, you have to come to the table with some level of equal effort to arrive where you are. People resent folks who arrive at a healthcare career with 80 hours, and they consider that to be the same as someone who's gone out and spent years to accomplish where they are. And it doesn't suggest that's the right attitude, but it is the prevailing attitude. Just understand it, and understand that education is important, not only for education for the right reasons, because it helps you solve problems, but it's just a requirement in the politics of making it work, and it sure helps eliminate many of the frustrations people have when you run up against the bureaucracy.